Hola y buenos días a todos y
Good
todas.
morning to all of you. Thank you for connecting to this press briefing offered by PAHO on the COVID-19 pandemic in the Americas. My name is Pablo Lira with the Communications Department at PAHO. As usual, this session will be about an hour long, and we will be accepting questions up to the end. We already have some questions that were emailed to us, and you can add more questions through the Q&A button. Please remember to include your name and media outlet when asking your questions. Let me tell you that this session is being interpreted simultaneously into Spanish, Portuguese, and French, and it is also broadcast live on Facebook, YouTube, and Twitter. Today, Dr. Etienne will be addressing the situation of the pandemic in the Americas, and she will be reporting about one new initiative by PAHO to include or to increase the capacity the countries have for vaccine production. Together with Dr. Carissa Etienne, we have Dr. Jarbas Barbosa, Assistant Director, Dr. Ciro Garte, who is the Health Emergencies Department Chief, and also Mr. Jairo Andres Mendez, who is an expert on emerging diseases.
Good morning, and thank you for joining today's press briefing. Over the last week, the Americas reported over 1.5 million new cases and nearly 20,000 COVID-related deaths. 3 countries, the United States, Mexico, and Brazil, had the highest number of cases, although COVID-19 cases continue to be reported across our region. Many Central American countries, including Belize, Guatemala, and Honduras, are experiencing a rise in COVID-19 infections. And while hospitalizations are continuing to decrease across much of South America, infections remain high. So we urge countries to continue to stay on top of new outbreaks. Jamaica, Puerto Rico, and smaller Caribbean islands like St. Vincent and the Grenadines and Dominica have reported steep increases in new infections and deaths. In Haiti, the Ministry of Health is coordinated with humanitarian partners and has asked for additional surgical and trauma care support for the victims of its recent earthquake. PAHO continues to distribute much needed medical supplies and is working closely with the Ministry of Health and emergency teams on the ground. Even as our region continues to lead global infections, with 7 of the top 20 countries and territories with the highest mortality rates in the world found in Latin America. Just over 23% of people in Latin America and the Caribbean have completed their COVID-19 vaccinations. In many countries, coverage is much lower. Just over 3% of people have been fully vaccinated in Guatemala, and a little over 4% in Jamaica, while vaccination campaigns have been further delayed in Haiti following recent natural disasters. Today, vaccine inequity remains the Achilles heel of our response. Delays in production have meant that many countries are still awaiting the doses that they purchased months ago. Some are left no choice but to rely on donations to immunize their populations. And while PAHO and COVAX are working to deliver nearly 12 million COVID vaccine donations from the US, Spain, Norway, France, and Sweden, these vaccines will not be enough to protect the hundreds of millions of people who remain vulnerable in our region. Limited vaccine supplies continue to set us back. A handful of companies produce all the world's supply of COVID-19 vaccines. Many of them are letting price and country of origin, not need, to determine how doses are rolled out. So much of today's vaccine supply remains in the hands of wealthy nations around the world. This limited production and unequal distribution of vaccines in the face of staggering demand hinder our COVID response, and they put public health in our countries at very high risk. Latin America and the Caribbean are especially vulnerable since we depend almost entirely on other places to produce the raw pharmaceutical materials, medicines, and health technologies that our populations need to stay healthy. Our region imports 10 times more pharmaceuticals than we produce. Just as manufacturers adapted quickly to produce some of the PPE and ventilators that our region needed earlier in the pandemic, we must bring the same spirit of collaboration into vaccine production in the region. The good news is that we are not starting from scratch. Today, 4 countries in our region are already involved in manufacturing COVID-19 vaccines. And Brazil and Cuba are producers of WHO pre-qualified vaccines for yellow fever and meningitis B, respectively. We must build on this legacy to protect our people from the threat of COVID and from future health risks. PAHO is already spearheading initiatives to help reduce our dependency on pharmaceutical imports. Together with the WHO, we are working to bring mRNA vaccine technology into our region. mRNA vaccines are some of the most effective vaccines against COVID-19. And the technology is highly adaptable. So it has enormous potential to be used against other viruses. So far, over 30 public and private companies and institutions in the Americas have expressed a desire to participate in the WHO's mRNA technology transfer program. And we are in the process of identifying the most promising proposals, establishing a cooperative process that can take advantage of existing capacities in different countries, and ensuring that this production can benefit all the Latin American and Caribbean countries through the PAHO revolving fund. But building our region's production capacity will take time. And our success rests on 3 things: coordination, collaboration, and investments. For this to work, countries must coordinate across sectors to strengthen their capacity to produce new technologies. Participating countries will need new policies to make this a priority, both so they have the technical competencies like bioengineering that is needed to scale these products, and a robust regulatory infrastructure or framework that ensures quality, efficacy, and safety. So this week, PAHO will launch a platform to boost regional vaccine manufacturing efforts, beginning with the first in a series of meetings to promote greater coordination across countries and to enlist partners from both the public and private sectors to turn this idea into reality. Because we will need to collaborate to build on each other's strengths. And that's why it's so important to bring them together. There are many ingredients and steps to making vaccines. So we need to map and optimize the supply chains to efficiently manage these steps across our region. Just as countries work through PAHO's revolving fund to pool demand for vaccines, they should leverage economies of scale to distribute pharmaceutical production capacity across the Americas. For regional production to be sustainable, production cannot be concentrated in one place. Finally, expanding pharmaceutical production will require considerable investments. The Inter-American Development Bank, the World Bank, and other partners have already expressed their desire to help our region to expand its pharmaceutical production. But countries must also prioritize investments and work together to maximize available funds. I believe that the ongoing COVID-19 vaccination crisis must be a wake-up call that we must expand regional pharmaceutical production so we can be in the driver's seat of our own pandemic responses. The region's values of Pan-Americanism and solidarity can help us strengthen pharmaceutical production. The investments that we make today will not only help us get through this pandemic faster, but they will also lay the groundwork to deal with future health crises. So really, we have no time to waste.
Perdón. Muchas gracias.
I apologize. Thank you very much, Dr. Etienne, for your opening remarks. Now we are going to start with the questions that we have already received. And the first one is by Gisela Salomon from Associated Press. At the outset of the pandemic, some experts had estimated that 2 years would go by until we would be in a position to control the virus. December would be the 2-year anniversary of the detection of the virus in China. What are the projections of PAHO for the region? When do you estimate to be able to go back to normalcy? Dr. Barbosa. Thank you very much, Gisela, for your question. I think that we're all anxious to know when we will be able to have the pandemic under control. But there shouldn't have been any estimates at the outset, and we do not have the conditions right now to determine when the pandemic will be over. We know we are closer than we were a year ago. Why? Because we have vaccines, and the vaccines evidence day after day that they have the capacity to save lives, also to diminish the number of severe cases, and also the number of individuals that need to be hospitalized due to a severe form of COVID. So how much longer? Until the countries have access to the vaccines. And the more people we have vaccinated in the countries, the closer we are to coming to an end to this pandemic. We're also closer because we have seen a great amount of evidence showing that the use of masks, for example, we have data that shows that if everyone used the masks, this could reduce transmission between 10 to 20%. So we need to maintain these measures to avoid crowds, to maintain the use of these masks, and also expand the access to vaccines for everyone to be vaccinated. I think that these are measures that will bring us closer to the end of the pandemic. So I think that this is the great task we have ahead of us. That's to say, to maintain surveillance, to maintain all of the measures, and also to expand access to vaccines for everyone. Thank you. Thank you very much, Dr. Barbosa. Now I would like to ask a question that we just received in connection with the opening remarks by Dr. Etienne. The question is whether this new initiative that PAHO is announcing, whether this implies to open the vaccine patents. Thank you. The issue of patents and intellectual property is something that is at the core of our debate, and there are some decisions to be made by the countries and also the World Health Assembly and the governing bodies of PAHO about the possibility to use the flexibilities that are provided for in the IP agreements worldwide. But what we are discussing and what the director has announced is something that goes beyond a measure. We're talking about a complex problem, and in general, when we are presenting simple responses to complex, very complex problems, those responses are not the best. We're talking about an initiative to strengthen the productive capability of the region, to support what we already have, to strengthen the productive development capacity, to try to share those strengths that we already have in the region. If the 4 or 5 countries that are already interested or that are already producing vaccines in our region could create a consortium and also produce and share, we would be increasing the capacity in the region. We're also talking about a platform to transfer new technologies such as the mRNA vaccines. These are new vaccines in the region that can be used not only for COVID, but in the future, we could also use them for other viruses of significance. We're also talking about the need of an important investment in resources for the development of government initiatives and also private companies. We're talking about something that has a time frame to be able to be implemented in the region, which will require political will, the decision of the country's commitment, well beyond the health sector. So I think that this is the initiative behind the platform that is intended not to offer just a 1-month response, to be able to offer a solution to strengthen the production capacity here in the region for PPE, ventilators, medicines, which we are importing many more than we can actually produce, and also for the vaccines. This is a broader view to be able to strengthen the capacity in the region and also to reduce the vulnerability and the reliance that Latin America and the Caribbean have at this moment.
Now, the next question is going to be in English. A couple of journalists asked the same question, including Tanya Smith Cartwright from the Bahamas, the Tribune in Bahamas, and Yerson Collave de El Comercio in Peru. And the question is, several countries have started offering booster shots to portions of their population. Is this advisable? Dr. Etienne, could you please entertain this question?
So, well, let me thank all the journalists for this question. After reviewing the data and the scientific evidence that is available, our technical advisory group on vaccines and the WHO Strategic Advisory Group of Experts on Vaccines, known as SAGE, recommended that the highest priority today is to rapidly expand vaccination to cover the vulnerable groups that can develop severe forms of COVID-19. This measure will reduce hospitalizations and deaths. After accomplishing this goal, the countries need to guarantee access to vaccines to achieve the high immunization coverage, about 80% or even more, which is the estimated coverage necessary to control the transmission. On the question of the third doses or boosters, we actually don't yet have enough evidence to make a recommendation for a third dose. Experts are carrying out studies, clinical trials, and data collection to gather scientific evidence that will support the recommended recommendation of a third dose or boosters. But I think it is essential to have all this data analyzed to allow us to make the proper recommendations that may be different for each vaccine and different for specific groups, such as immunocompromised people, the elderly, and the general population. But let us stress that the important fact here is to highlight that the best production against the new variants of concern is to control transmission everywhere. And so for this reason, the urgent need to have equitable access to vaccines is an ethical imperative, and it is the best public health response to this threat. You know, our countries urgently need COVID-19 vaccines. As I noted before, less than 25% of people in Latin America and the Caribbean have completed their COVID-19 vaccinations. And in some countries, this figure is less than 5%. So what this means is that we have millions of people who are not yet protected. Lack of access to vaccines is hampering our response to the COVID-19 pandemic. You know, some countries have not been able to offer the second dose of the vaccine, which is critical to ensuring protection. In addition to the deployments of COVAX vaccine, PAHO is working to increase the accessibility of our countries to vaccines through appeals for more and immediate donations from the developed countries, and including the direct purchases by our revolving fund. But you know, we still have a long way to go to vaccinate our people against COVID-19 and thus control the pandemic, which will allow us to resume our economic activities, to recover the economy, and to reduce the dramatic social impact of the pandemic. Meanwhile, I pray, please continue to observe the recommended public health measures, including wearing of masks, social distancing, adequate ventilation, avoiding crowded, closed spaces, and the other measures to reduce transmission and protect ourselves. Thank you.
Many thanks, Dr. Etienne, for this answer. So the next question is coming from Raquel Scott in the Nassau Guardian in the Bahamas. The question is, the Bahamas is in the middle of the worst surge of COVID infections since the start of the pandemic. In this context, the country is headed into general elections in only 3 weeks' time. What is PAHO's recommendation on how to have a safe election, given the challenges the country is facing? Dr. Ugarte, por favor.
Thank you. Thank you. This question has been discussed also in previous occasions. It is important to highlight that there is the right to vote to elect the national officials, and also the right to health to control the pandemic. In this regards, there have been many elections where PAHO has been providing technical, operational, and guidance to reduce the transmission during the process of the elections. We've seen that the higher transmission occurs during the campaign rather than in the day of the elections. So it is important to avoid situations where the physical distancing is very difficult to maintain. And in that regards, to use masks all the time. And of course, use also other measures, including the hand sanitation and others. It is important also to assess the situation of the transmissibility and look to the health services, the availability of beds, both hospitalization beds and ICU beds. So if there is an increase of the number of cases for several reasons, including the transmission that is ongoing in most of the countries in the Caribbean and Central America, we need to emphasize that this situation may, the elections may provide opportunities to higher transmission. It is also important to have the electoral committees to organize the election day in a way that the persons will maintain physical distancing and reduce the transmission on the surfaces, for example, that the persons may touch. Those and several other recommendations, including communication to the persons who will be facilitating the process and also the population who will go to vote. In that regards, it is extremely important for the candidates to take this, the COVID-19 context in a serious matter, because they will protect the population at the same time that they will also move on the election process. Thank you.
Muchas gracias, doctor Ugarte. En seguimiento, hay
Thank you
dos...
very much, Dr. Ugarte. We have two follow-up questions that also go back to what Dr. Etienne said at the outset. The first one is by Matias Luis from Argentina, and he's asking, is there any information regarding the number of modified mRNA vaccines that could be produced in the region for 2022? Any estimates? And also from Web Salud, Violeta, what are the countries that could be producing vaccines against COVID-19 at the outset based on these proposals? Dr. Barbosa, please go ahead. Thank you. Thank you very much for the interest in this initiative that our director has just announced. Indeed, we are at the outset of this process. Therefore, there are some questions as to how many vaccines will be produced. We are beginning with this process, and as the director just mentioned, this is a process that is intended to be feasible, that is to say, that can be actually implemented in the region. I think that for 2 months ago, we had our first meeting to discuss the initiatives for technology transfer in connection with mRNA vaccines in the region. We had more than 300 individuals who attended that meeting virtually, and we had some time to receive proposals. We received more than 30 proposals in the region and they were proposals presented by consortia, by different partnerships, private companies. So we are reviewing all of those proposals, and in the month of September, we will be announcing, our director will be announcing the proposals to be taken into account for the initial project. The criteria will be to consider the most feasible proposals, that is to say, those that meet all of the conditions, where the country has a good regulatory system, the country already has the capability to produce at least a component, the country already has some guaranteed public, private, or public and private investment to support this development. All of this will be analyzed, and the general idea is to have, as our director just mentioned, shared production. That is to say, to take advantage of the capabilities that we already have in the region in many of the countries that already produce components that could be used for the production of an mRNA vaccine. Second, the principle behind this initiative is that this initiative should benefit all of the countries of the Americas and Latin America and the Caribbean. It is not just for one country to produce vaccines for itself. All of the vaccines produced by this consortium will be distributed through the revolving fund. They will be offered through the revolving fund for all of the countries in Latin America and the Caribbean to benefit from this. Not only producing countries, but all of the countries may benefit from this. As to the timeline, I am quite certain that this will depend on the analysis, on the more detailed analysis of all of the proposals, but it is not a short-term response. We are not attempting to have vaccines in 1, 2, or 3 months. This is not feasible. This is a strategic approach for the region that has to be properly planned, properly implemented, so that we can expand the production capacity in our region. Thank you very much.
Thank you very much. The next question is from Blanca Valadez from the Grupo Millennium Mexico. Could you please clarify whether the Delta variant is more transmissible than the viruses causing MERS, SARS, Ebola, common cold, seasonal flu, and smallpox, and as contagious as chickenpox? Well, thank you very much for this question. Delta has a high rate of transmission. We know this. Virus like the original SARS or MERS are very well adapted to their natural environment. camels or bats, but they did not become well adapted to humans. And that's why transmission is not as successful. It's very hard, though, to compare viruses. It's not easy to compare Delta with others having different pathways of transmission with great variations. For example, Ebola is transmitted very easily, but you need to be close to the patient for transmission to be successful. It is lethal, but the transmission is not as rapid because the contact needs to be very close to other people, and people need to be close to the person and the fluids. Also, for the flu, it depends on the viral load. In the case of the flu, vaccination also enters into the picture. Closeness and closed areas that are not very well ventilated are a situation in respiratory viruses. Now, the varicella viruses, they are different. Depending on the disease, there's a possibility of higher transmission only when the contact is close again and when the virus is active in the regions. So I would like to say that viruses evolve to become better adapted to their host, in this case, humans. They become more transmissible, but not necessarily more lethal. Viruses need a live organism to subsist and become reproduced. And this is what we're seeing with SARS-CoV-2 and its variants. We see the virus is evolving to become more transmissible, not necessarily more lethal, but it needs to become more successful. That is its own goal. And that is what we need to take into consideration. Thank you very much for your question. Thank you, Dr. Mendes. From Daniel Polin from TN23 and another journalist from Guatemala. The questions are, what is your opinion about the current situation of Guatemala vis-a-vis COVID-19 during the third wave of the disease, and what actions should be strengthened, taken into account that the Lambda and Delta variants are already in Guatemala? Dr. Ugarte, thank you. Guatemala is going through one of the hardest situations from the beginning of the pandemic. The number of cases has increased significantly, with daily reports of up to 5,000 cases, and the presence of the variants of concern, including the Delta variant. Guatemala had increased the number of hospital beds and also ICU beds up to 2 or 3 times the original amount they started with. However, given the increase in the number of cases in very short periods of time, the bed availability in many hospitals is very low. Occupation is close to 100% or 100%, and the overload of work for the health workers is very high and has been very high, especially last few weeks, in a context of low vaccination rates and with significant differences in vaccine coverage in bigger cities as opposed to rural areas. The likelihood that the virus continues to be transmitted if no control measures are adopted for transmission will be very high. The projection from the health ministry and reflecting in the use of the traffic lights as they are published on their website and as shared with PAHO show a trend of increasing numbers of cases if urgent measures are not adopted. Among them, of course, are the measures such as use of masks in every place, but also hand washing, physical distancing, etc. In this context of a very significant increase of cases in Guatemala, availability of PPE for health personnel, the availability of supplies for patients, and monitoring all health services all of this will make it necessary to have a reorganization and a reinforcement of the health services and health service systems in Guatemala in order to be able to take care of confirmed patients, and also, on the other hand, to reduce transmission. Measures should be adopted. Those we are well familiar with that are very useful, and I have mentioned here. So we are following, we are closely working with the authorities in Guatemala and with medical authorities as well, so that the cases are reduced as much as possible, and that the involvement of and the number of patients and deaths is maintained and not continue to increase. As Dr. Etienne has mentioned, it is very important that a greater availability of vaccines is a reality. Vaccines are not many in Guatemala. So not only through the COVAX mechanism, but also donations are urgently needed in Guatemala to protect the Guatemalan population. Thank you very much.
The next question comes from Patricia Rodriguez Calva from Grupo Imagen in Mexico, and I'll read the question in English. Children in Mexico and in other countries of the region are preparing for a return to classroom learning. Is PAHO in agreement? What are your recommendations about back to school? Dr. Etienne, please.
Oh, thank you, Patricia, for this question. It goes without saying that schools are essential to the health, safety, and well-being of children and adolescents, and that education is key to reducing poverty, promoting gender equality, and safeguarding sustainable development. With schools closed, children are more likely to experience violence, hunger, and mental health issues. So the sooner we can return to in-person learning, the better. Children and adolescents in Latin America and the Caribbean have also been harder hit by school closures than children and adolescents in any other region of the world, with over 101 million girls and boys being affected. So reopening schools is and should be a priority for governments, parents, and of course, children themselves. However, our region continues to be the epicenter of a severe global pandemic. More than 2 million people have died in the Americas, and over 82 million cases have been reported since the pandemic began. So we do have community transmission of COVID-19 in almost every country. And what we do not want is for schools to be transformed into a catalyst for more community transmission. Schools must remain a healthy setting for living, learning, and working. Schools closure and reopening should be considered as part of the set of social distancing measures that national and local authorities are constantly adjusting, depending on the epidemiological situation and the local response capacity. PAHO recommends that school reopening is done in a phased approach that takes into consideration the local epidemiological situation, and which can change rapidly. So surveillance will be key to ensuring that reopening is done safely and that learning environments remain safe. Prior to reopening, countries must ensure that schools can maintain COVID-19 prevention and its control measures, such as social distancing, hand hygiene, mask wearing, and the safe and accessible transportation to and from school is also an important consideration. So PAHO has developed guidance for school reopening, and we are working with our member states so that this can be achieved as safely as possible. But ultimately, the safest way to reopen schools rests on countries' abilities to suppress transmission through vaccination and the implementation of these public health measures. And this is the only way that we can fully protect children, teachers, parents, and the community.
Thank you, Dr. Etienne, for this answer. La pregunta siguiente es...
Now, the next question is from Nora Gomez Torres from the Miami Herald.
The next question from Nora Gomez Torres from the Miami Herald is, has the Cuban government submitted data about its vaccine candidates? Can PAHO speak about their effectiveness? Has Cuba made any requests of vaccines through PAHO? Dr. Barbosa?
Okay, thank you for this question. First, let me explain how is the process. No vaccine needs to share its documents with PAHO or WTO. A vaccine needs to receive a license or an authorization for emergency use from a national health authority. This is the situation of the vaccine in Cuba. The Abdala vaccine was submitted to SECMED, that is the national regulatory authority in Cuba, and SECMED authorized its use. If a vaccine wants to participate in the COVAX facility or wants to be offered to other countries in Latin America and the Caribbean through the revolving fund of the Pan American Health Organization, this vaccine needs to share all the information about the quality of production, safety, and efficacy. So far, the WHO pre-qualification team has not received the information from the Cuban vaccines. So we really don't know what is exactly the effectiveness. The data that were released by the government were informed that the vaccine was very effective, but we need to see this data published in journals, scientific journals. And again, if the vaccine wants to be offered through the revolving fund or through the COVAX facility, it needs to receive the emergency use listing authorization from WTO. And so far, it has not been the case. Cuba is not part of COVAX mechanism, so Cuba has not asked any vaccines through COVAX or presented a proposal for the revolving fund. Probably because the Cuban government is relying in their own national production capacity. Thank you.
Thank you, Dr. Barbosa. The next question is from Annalisa Poe from The Guardian in Trinidad and Tobago. Health officials have reported an increase in COVID-19 cases among the younger population in Trinidad and Tobago. What can you say about PAHO's finding regarding the virus in children? Dr. Mendes?
Thank you very much for that very important question. There is no evidence so far to support a particular increase of transmission by Delta variant in children. Perhaps other factors are generating the increase of cases in different age groups. For instance, we know that older population is usually more careful with the control measures. They used to be more conscious about the distancing and have been prioritized for vaccination in most of the countries. With this, the virus is going to try to maintain the transmission in a different population, more likely younger population, where sometimes the adherence to the measures like the use of masks or social distancing is usually more relaxed or difficult to maintain. So there is not a particular biological issue regarding the transmission of Delta in children, but again, we have to stop and we have to try to limit the transmission in all the populations so we can protect also our children. So thank you very much for the question.
Muchas gracias, Dr. Mendes.
Thank you, Dr. Mendes. And we have two follow-up questions about Venezuela. Nicole Yapur from Bloomberg News asks, the Venezuelan government has not reported on the arrival of new doses of vaccines in the last few weeks, but the continuity of the vaccination process suggests that they have received more vaccines than those they have officially announced. Does PAHO have any news about how many vaccine doses has the country received? And from Gisela Salomon from Associated Press, are you supporting countries in the region, especially Colombia, in order to acquire vaccines to vaccinate the migrant population, both the Venezuelan migrant population and others? Thank you very much for your question regarding the vaccines that Venezuela are using to vaccinate their population. These vaccines come from negotiations and relationships that Venezuela has through bilateral agreements. And through those mechanisms, they have been able to receive vaccines, and we understand that they will continue to do so into the future. Meanwhile, the COVAX vaccines have also been arriving in Venezuela regarding the support to Colombia and other countries with, well, first of all, from the planning phase for vaccinating migrants, not only from Venezuela, but from other countries and in all countries of the region, we have been working with the PAHO immunization programs and the Ministry of Health immunization programs to include migrants and other vulnerable populations in the vaccination schemes. So the demands need to be established. How many vaccines are required? Where are the migrants? In the case of Colombia, we know very well that yes, in fact, they have received in recent years a large amount of Venezuelan migrants, as well as also Peru, Ecuador, Chile, Argentina also received numbers of migrants from Venezuela. In the case of Colombia, they included regularized migrants into their vaccination schedule. So Venezuelans and others have received vaccines. The latest numbers we've been given is that over 17,000 doses were given, and most of them were given to Venezuelan migrants. In the case of Peru, the amount of doses given to 76,000. And these are just examples where everywhere Venezuelan migrants are being included and vaccinated. But of course, we need many more vaccines because migrant populations are large in these countries. And therefore, through donations, such as, for example, the donation from Canada. Canada has generously supported countries through PAHO, and support has been provided by Canada to countries receiving migrants from Venezuela and other countries. So we're in the process of purchasing vaccines through COVAX and also through other mechanisms, such as in the case of Colombia, were coordinated according to bilateral agreements that Colombia has with some manufacturers. So that these vaccines can arrive in Colombia as soon as possible and also to other countries. So this is work for the long term. And so both migrants who are regularized in a country, who have their authorized permit, permission to stay in the country, as well as those who don't have the appropriate permits, should be involved in vaccination programs. Because if we do not reduce transmission of, in order to reduce transmission and limit transmission, we need to include everyone in vaccination. So if people become ill, they won't be seeking medical help, and they will continue to transmit it. So it is not only out of generosity, but it is also a measure of public health to reduce the risk of transmission in the countries themselves. Thank you very much. Thank you, Dr. Ugarte. The next question is also related to the announcement made by the director of PAHO, Ms. Vitela from Mexico asked, Mexico could participate with the Patria vaccine in the initiative launched by PAHO today. Dr. Barbosa, thank you very much for your question. All countries will be able to participate in the initiative. And as I said before, I received more than 30 proposals from the countries. This platform can be widen for other possibilities. But right now we are taking a very pragmatic approach. We know that many times good intentions that are started and we're going to be manufacturing things everywhere. All of this sometimes is just a pipe dream and it doesn't become a reality. So as we said before, the first step for this platform is to facilitate the process of technology transfer from some biotechnology companies that are in agreement to do the technology transfer for manufacturers in Latin America and the Caribbean who have conditions and are interested in producing the RNA messenger vaccines such as the ones used by Pfizer and Moderna. This is the technology. So this is the first very concrete, very pragmatic step. It is to seek a process of sustainable, feasible technology transfer method with public and private investments in the countries based on a capacity that some countries in the region have to produce components which are important for these messenger RNA vaccines. So this is the first step in the platform. And of course, it is very important to support and recognize the efforts made by some countries of the region to develop vaccines using other platforms, vaccines against COVID-19. Of course, it is always important to recognize, and when they request PAHO's support to provide technical support regarding regulatory topics as well as other topics to support those developments, PAHO is open and willing and working with the countries. Thank you very much. Thank you very much, Dr. Barbosa. The next question is, well, we have a few questions from the Caribbean. Candim Joseph from The Observer in Antigua and Barbuda asks, I'm going to read it in English.
The question is, with the winter tourism season approaching fast and many Caribbean countries still not at herd immunity, does PAHO support a move to welcome only vaccinated tourists into these countries as another precaution? And also Jasmine Brown from the Bahamas. The cruise industry has resumed in the Bahamas. However, in recent weeks, there have been COVID cases on ships. Is this cruise risky? Is the cruise industry too risky at this time, considering the fact that COVID cases are surging in the region? Dr. Ugarte, por favor.
Yes, those questions are very important because tourism, as other areas of the economy, need to resume in most of the countries, particularly in the countries in the Caribbean that whose income comes from the tourism, particularly. In that regards, we have been in contact with all the member states, all the countries, to advise on how to move on resuming tourism, and with specific recommendations on how to approach both the cruise ship industry, but also the ports where the visitors will land. And we have been discussing on the risk analysis, both on the, for example, in the areas where the tourists will go, including the transmission, the availability of health services, the testing capacity, and the epidemiologic surveillance, etc. And on the other hand, it is the recommendations for the tourists to not to begin international travel unless it is necessary. And if it is necessary, to take all the precautions, including, for example, previous to the trip and during the trip, all the measures that we know that are effective. Regarding the vaccine, the patients that are vaccinated are clearly better protected from the disease in the severe cases or hospitalizations and deaths. So those populations are in better shape to take international travel, and many countries, including in the Caribbean, are adopting certain measures to facilitate the travels of international travels to people that got vaccinated. But because most of the population in the world is lacking the vaccine, we do not recommend that as a restriction. But yes, of course, it is a measure that many countries are using, for example, to reduce the quarantine, to reduce isolation, and to facilitate the movement of those people, ensuring that at all times, both the tourist industry personnel and also the cruise ship crew are fully aware of the situation, and they do have the early detection capacity and the ability of the health services to cope with increase of cases among the tourists, but also in local population. Thank you.
Muchas gracias, Dr. Ugarte. La pregunta seguinte de...
Thank you, Dr. Ugarte. Now, Medina Ochoa from Uno TV, Mexico. What is the opinion of PAHO about the decrease in cases of coronavirus in Mexico, according to the Secretariat of Health at federal level? Is Delta circulating 100% in the country? Dr. Mendez. Thank you very much for your questions. In Mexico, to this point, from the beginning of the pandemic, over 3.2 million cases have been confirmed and about 254,000 deaths due to COVID-19. At present, at August 24th, about 116,300 active cases of COVID-19 in Colima, Mexico City, Tabasco, and San Luis Potosí have been recorded. Undoubtedly, control measures implemented by the country, including, of course, vaccination, have allowed that the increase in number of cases is spreading less quickly. However, constant surveillance should be maintained, and this is hand in hand with genomic surveillance. And in this case, Mexico, through INDRE, has one of the soundest genomic surveillance networks, and they are one of the regional reference labs, and they have been able to generate many sequences and detect 15 variants, including alpha, beta, gamma, and delta, which is the variants of concern. Delta represents over 4% of the strains reported and up to 97% of sequences reported just for Mexico City, which has led to show displacement of other variants such as alpha and gamma. We knew this was going to be so. The greatest circulation of Delta at this point in time has been seen in Sinaloa, Baja California Sur, Veracruz, state of Mexico, and Mexico City. I would like to say that Mexico has active genomic surveillance that complements epidemiological surveillance, and this has allowed to be able to follow where and what places is there more prevalence of variants such as variant. I hope I answer your question. Thank you very much. Thank you, Dr. Mendez. There are some questions from Nicaragua, from Lidia Lopez, from La Prensa, and from Abigail Galo from Radio Corporación. And they want to know, in Nicaragua, a large portion of the population is waiting with no dates or no information to complete their vaccination schedule. What does PAHO recommend regarding the strategy to give the second doses? Abigail asks, could PAHO demand from the Nicaraguan government the exact number of people who have been vaccinated in the country? Because to this point, this is unknown. Dr. Ugarte, please. Thank you, Pablo, for the questions from Lydia and Abigail. Nicaragua, let's remember that Nicaragua has only received one batch of vaccines through the COVAX mechanism due to the situation in India, who was the one in charge of producing the vaccine to send to Nicaragua. However, several countries, Norway, Spain, have provided donations of vaccines to Nicaragua, and Nicaragua has also bought vaccines through bilateral agreements, and therefore they have been able to continue with vaccination. Yes, in fact, Nicaragua has received a limited amount of AstraZeneca vaccine, and they have recommended up to 9-week intervals according to the schedules recommended by the advisory group. So the people who have received the first dose have been told to be on the lookout for the arrival of more AstraZeneca vaccines. Information regarding the total number of vaccines and some details regarding vaccination have been published in PAHO's website with the information provided by the Health Ministry. And for example, it seems that 612,000 doses of the vaccine have been given, 412,000 for the first dose and 200,000 for the second dose. There is no details about population groups or areas of the country. However, these data are also published in the database that we have at PAHO. And I would like to draw the attention of all actors to please contribute with information that allows us to not only follow on the progress of vaccination, but also to do follow up on transmissibility, presence of variants, bed occupation, availability of protection equipment. All these are elements that are part of COVID-19 response, including, of course, vaccination. Over.
The next question is a question we just received in the chat. Can you give us any updates on the situation today in Haiti after the earthquake? Dr. Etienne, please.
So let me thank you for this question. Of course, the situation in Haiti remains high risk and serious. PAHO and the Ministry of Health of Haiti, we have deployed teams in the Sud Department to conduct rapid assessments of health institutions and to set up a data reporting system. So far, rapid assessments show that 59 health facilities were affected in Granans, NIP, and Sud departments. 27 of these 59 were severely damaged. And Haiti's Civil Protection Agency reports that some 2,207 people were killed, that 12,268 people were injured, and that there are still 320 people missing. Of course, we grieve for the lives lost and for those who were injured, and we are doing everything to assist the government of Haiti. Logistics and security challenges continue to limit the delivery of supplies, the deployment of personnel to the affected areas, and the transfer of patients to other hospitals. Haiti's immediate health sector needs include medical personnel, medicines, supplies, and stock management, mental health and psychosocial support initiatives, implementation of prevention and control measures for communicable diseases, water and sanitation operations in health facilities and shelters, and the rehabilitation of injured patients. Of course, as PAHO, we are focusing much more on the health situation. However, over 8,300 people have been displaced as a result of the earthquake, and they are mainly in 26 shelters. Haiti's civil protection continues working on speeding up the process of channeling aid to the affected areas. The priority needs are shelter, health, water, and food. The next operations will be conducted with significant support from the US Army. PAHO is also deploying additional staff to the affected areas to support government operations, including the syndromic surveillance in shelters and rapid testing for COVID-19. We are also coordinating with the Ministry of Health on the deployment of emergency medical teams. And so far, 7 of these teams have been deployed, 4 more are due to arrive, and others are on standby. Haiti's COVID-19 vaccination efforts are continuing, with some 25,000 people vaccinated thus far. Additional vaccines are also expected, and vaccination drives are starting again on Saturday in several communities of the West Department. I thank you for continuing to keep Haiti in your thoughts and your prayers, and certainly to do all that we can together to alleviate the suffering and improve the conditions for the peoples of Haiti. Thank you.
Muchas gracias, Dr. Etienne. Y gracias.
Thank you, Dr. Etienne, and thank you to all the other panelists. We have come to the end of our session today. Please remember that you can also always find information on COVID-19 and the regional situation on our PAHO website. Thank you very much for being with us today, and let us take care of ourselves. Thank you very much.